Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM, 1080 AM WUFO. I'm your host, Francesca Messiah from Kaleida Health Foundation, and hope this year will be a great one for you as we roll into the month of March. And last month, we focused a lot, our country did, our community did, on Black History Month. And this month, which is a month of March, is Women's History Month. So this month, we'll be focusing more on women with women guests and women's topics and diversity topics. Well, I just want to let you know again, who is Kaleida Health? Well, Kaleida Health, we are not only the foundation, we are hospitals, we are home care, we are long-term care nursing homes, we're clinics, we're laboratories, and we're the Great Lakes Health Cancer Care Collaborative, which is one of our newer affiliates on part of the Kaleida 10,000 plus family. Our hospitals, I don't want to go lightly talking about our hospitals, but our hospitals are Buffalo General Medical Center, Millard Fillmore Suburban, Gates Vascular Institute, Oishei Children's Hospital. We have DeGraff Medical Park. We have High Point, which is our long-term care and rehabilitation facility. That's at the corner of Michigan and High. We also have DeGraff, again, for long-term care and rehabilitation. They're in North Tonawanda. And we're also the Visiting Nursing Association. And we have clinics for women, for children, for adults. We have our endocrinology center for diabetes, which I'm getting a lot of information. I always have information at my table, at the Kaleida table on diabetes. So I just want to make you aware of that. Also, did you know Kaleida Health is hiring? We're hiring for all positions. And to learn more about what positions are we hiring, but again, we're hiring in all areas. Remember, hospitals are open 7 days a week, 24 hours a day. Please visit our Kaleida Health website. Just Google Kaleida Health, KALEIDAHEALTH.org, and go to employment or jobs, and that will come up. And so getting into our show, our guest for today is not a stranger to the program. Matter of fact, I think she's been with Kaleida going on 3 years now, and that is Shannon Bryant. Good morning, Shannon. How are you?
Good morning, Francesca. Thank you for having me. I'm doing well.
Oh, you're welcome. And Shannon was hired. It's been nearly we're going into 3 years, correct, Shannon?
Yes, a little over two, going into three.
Going into three. And Shannon was hired, and she's still doing and for the position of Chief Diversity Officer. And is it Chief Diversity Officer and Inclusion?
Chief Diversity and Inclusion Officer.
Chief Diversity and Inclusion Officer. And I should know that. I apologize. And Shannon she was hired when we didn't have that. We didn't have that. Kaleida's always been in the community. You've seen our face in the community, or you've seen me in the community, but we did not have something internally focusing on our employees, also working with the community. So I want to say Shannon has been doing a wonderful job. And today's topic, we'll be talking about diversity, equity, and inclusion at Kaleida Health. And, and we're going to jump right into it. And I know, Shannon, this has been nearly 2.5 years since you've been leading the diversity, equity, and inclusion division here for Kaleida Health. And I know there's still rumble, and I want to hear it from you. Why diversity is so important at an institution such as Kaleida Health, and what you've done to expand that.
Yes, thank you for having me on the show and for all those kind words. I certainly have still been going around and really talking to people about how and why diversity is so important to healthcare. One of the main sentiments is really around the fact that we are a place that takes care of people, and we support communities, and we know that there's lots of diversity within the people that we support and within the communities that we serve. So for us, it's really mission critical because of that. We're not looking to just do programs or do small things, but really embedding diversity, equity, and inclusion into all that we do. It's already embedded there, but really raising the awareness and the level of care and concern and strategic work that we do to focus and center the different diversity identifiers that we're trying to take care of in our communities.
And Shannon, I just have to say a word that you just used, mission critical. If you're writing a book, I would use that as a title. I like that, mission critical. Diversity is critical. Could you tell me what are some of the initiatives that you've been and your staff has been part of with diversity, equity, and inclusion?
Yes, we've been quite busy this past couple of years, I would say. Some of our initiatives are employee focused, and then we have some that are patient focused. So last year, we spent a lot of time looking more around our patient piece and trying to understand the specific communities that we traditionally have just been marginalized in the healthcare system or have a harder time navigating our system, trying to learn more about those populations and how we can support our clinical teams and caring for those patients. So one of the big initiatives was around SOGI data. And SOGI stands for Sexual Orientation and Gender Identity Data. We wanted to do a data project around this to ensure that questions around someone's gender, their pronouns, their affirmed names, or the names that they would like to be called, that there is a place in our electronic medical record to actually capture all of that data. Right now, we're still in the process of finalizing that project, but prior to the start of the project, we did not have a place for those identifiers to be captured. So if someone had different pronouns than their birth pronouns, that's not something that our clinicians could easily look at the medical chart and see. So making that efficiency for them helps to improve patient care. Certainly, it helps to improve the patient's experience with us as a Kaleida Health community. And this is something that's a heavy IT, if you will. It's a heavy IT lift. And we
IT, for our listeners,
for information technology within the system. So it's been a heavy lift as far as making sure this information can be in the electronic medical records. And so that is something that we spent a lot of time focusing on, and we're wrapping that project up where now people will see their pronouns and their affirmed names in the banner bar and in the charts of the electronic medical record. Those things will be represented on people's wristbands and their labels so that as they're going to different parts of the hospital, they're not misgendered or called the wrong name throughout their process here. So that's something that I would say I'm proud of us that we were able as a health system to embark on that journey, and looking forward to that being completed in the next year here. Another big kind of initiative for us has really been around building dashboards and using diversity, equity, and inclusion data to really create some strategic initiatives.
Hold on. Now, a dashboard, I'm driving a car. Is that what you're talking about? The dashboard that's in the front of your car, or is it a different dashboard?
That's a great question. These are dashboards that would be on a computer. So you might look at them to see what's happening in the system and have a trend or a snapshot of what's happening from an electronic standpoint. So anyone who might be creating strategic initiatives or anyone who's a clinician, some of our frontline team members might also use a dashboard if they're trying to come up with solving a problem or, something of that nature. So these dashboards around diversity, equity, and inclusion are really going to help people to start to look at the different diversity identifiers such as race and ethnicity, gender, age, sexual orientation, gender identity, looking at those different diversity identifiers and pairing that up with whether it be employee data. So it could be information around retention, around recruitment, professional development, or it could be information around our patient data. So for patient data, we might look at things like their patient experience scores, the harm scores, any kind of specific, like we focus a lot here on birth equity work. So we would be looking at C-section rates and stratifying those by race and ethnicity, those sorts of things. So we've been working to build those dashboards. Last year, we built an employee dashboard on DE&I data. And this year, we're focusing on patient dashboard for DE&I data. So those have been two big kind of newer initiatives that we focused on last year and into this year. And of course, we continued the work that we do with our employee resource groups. When I think last time I came on the show, that was something we spent a lot of time talking about. So those groups are still growing pretty strong, and they have quite a few things that they've accomplished. There are 4 groups.
Can I just ask a question before that I hear a lot of in the community, and pronouns. And after going through a training, I understand now, but now there's a lot of confusion about pronouns, and you just tied it in so eloquently into our charting and how patients are treated. And could you, before talking about the groups, if you could just take a step back and let people know what are the pronouns and why is it important for the pronoun identifiers as it pertains specifically to healthcare?
Yeah, well, we think of pronouns really as just how you want to be referred to. So it's the closest thing that people say to each other, other than their name. So if I don't know, that someone's name, I might say she or he or they or them. It just sort of depends on what that person would like to be called. So that's why that matters, because in the healthcare system, we're all about having person-centered approach and really looking at our patients as individuals and seeing what they need. So starting with calling them by the name that they would like to be called and the name that they go by. And also we need to know what pronouns to use in case we're referring to someone in an open situation and we don't know their name. Should we be saying she, he, they, them, or anything else that people might elect to give us? So for those reasons, it's pretty vital to the relationship building that really starts throughout the registration process and the waiting room, and then it carries on throughout the whole medical stay.
So what you're saying, if I see a male, I'll just say a male, sitting in the waiting room holding a handbag, but it looks like his handbag, he may not want to be identified as he, and having the proper pronoun could ease any tension in a conversation by calling him she, something like that.
That's right. Really, there's no way for us to know how someone identifies by looking at them, because there's also a piece around gender expression. So I might like to be called she, but I like to dress very masculine. That doesn't mean that I don't want to be called she still. And, you might see those same different things happen with people who might look like they're a she, but there's really just no way to tell how someone identifies by looking at how they present to you. So the best case is always to just ask people, hi, my name is Shannon. I use she, her pronouns. What's your name and what pronouns do you use?
Yeah, and people have to really start taking it seriously because to me it also cuts back on that giggle factor. So I'm just hoping that our listeners, and we may, bring you back again to make sure, because this is becoming a way of the world. This is not just a Kalida thing or a Buffalo thing. This is a country. Our country is going with the pronoun. So it's just making sure everybody understands. I just want to make sure our listeners. And one other thing that you mentioned that's very important, you talked about something about race and maternal health. And if you could just talk a little bit about why is there what's all the to do with race and maternal health? I'm saying more and more about it in the paper, and you are addressing it. Kalida Health and your staff is addressing it. And why is it important?
Yes, that's a great question. Here in New York State, we actually know that there's a huge initiative around birth equity, especially as it relates to Black, Indigenous, and people of color. So that could include Hispanic and Asian, other descent. That's something that we're really focused on from a New York State perspective because Black and brown people die 8 times more likely in New York State than their white counterparts, and 3 to 4 times more likely right here within Western New York. So that's something we'd like to see change. There has been a lot of research on the Department of Health website, and they have tried to figure out, really what's at the heart of those disparities that we're seeing when it comes to mortality. And what they found is that a lot of it comes down to Black and brown people who are coming to deliver don't feel as though their providers are listening to them. So if they're making a complaint about I'm feeling more pain or something doesn't feel right, sometimes those complaints are being ignored, and then the folks are going home and they're having higher mortality rates and higher complications. And that goes back really to a lot of the history within the medical field, and not really believing that Black and brown people could be educated enough to know what's going on with their bodies. So because of that historical past, we do see that this permeates in our system and in our healthcare system today. There's also some unconscious bias in believing that Black and brown people can tolerate pain at a higher rate than their white counterparts. And, we know that those things are not true, but, in a study as recent as 2017, there were some things that they found is that college students, med students entering into programs still held that belief that they did think Black and brown people had a higher tolerance of pain. So a lot of those things are just stereotypes or
it goes back to slavery.
Bias. Yeah. Right. Things 16, being passed 19. Down. Right. Yeah. Right. Yeah. And really not any proof of those things being true. But because of those attitudes, the interaction with the healthcare system can sometimes lead to these mortality rates being a lot higher. So because of that, we have specific initiatives to focus on improving those rates and really improving our awareness level around the disparities that do exist and some of those historical problems that we had, and really rectifying some of those things in our system today.
I'm just going to say bravo, and I know you're available for public speaking, and I'm going to move on to the next question. You were getting ready to talk about the employee resource groups. Sorry.
Yes. Our employee resource groups have also been quite busy this year and also last year. A lot of the work that they do, we have 4 of them, and I'll mention what the 4 are, but a lot of the work that they do, it's a blend of employees and people who are interested in supporting the communities that we serve. So it's mixing employee and community together, and they focus on specific identifiers. So we have one group that's called DIRE. They focus on diversity, inclusion, race, and ethnicity. And so you'll see them doing things around Black History Month. They do things around Hispanic Heritage Month, lots of cultural celebrations, and also lots of things around the social determinants of health, which impact, people's their lived environment, their transportation, their literacy, all those sorts of things that really impact health more holistically. So that's something that team focuses on. We also have a group called SAGE, which stands for Sex and Gender Equity. And that group is focused on our LGBTQ plus population. And really, they've supported a lot of the work around the sexual orientation and gender identity data being in our EMR system, which is our electronic medical record. And they also support any patients or employees who are or identify as LGBTQ plus. And then we have our Veterans and Families group. And this group really looks to support both, again, employees and patients around the recognition of folks who come to receive their care at Kaleida Health who have served in the military. We want to be able to use that really as a strategy to connect with those patients. So we have a lot of clinicians who have also served in the military, and that can often be a nice connection point. So bringing more recognition to the people who are veterans and are getting their care with us will help the patient relationship. And then also hiring more veterans. So we know that when people come, once their military time is over, sometimes it can be difficult for them to transition into a corporate setting, to another role. So really working with our recruitment team to see what are some of those transferable skills that can be utilized in other roles here. So in the military, if you were a high-ranking leader, how might we be able to transition those skills into a leader within the healthcare system? So working with, again, the employee and the patient side and really bridging the community piece. And then we have one final group, and that group is known as our working parents and caregivers. This group is one that I think is really relevant to our day and age here, where, when we had COVID happen and a lot of people were stuck home with their little ones, it was a different sort of empathy that we had to develop for our working parents and caregivers. And we really took more notice and focus on the structure of a family and really how important that is to everyone's lives and really having that work-life balance. So they focus on things like wellness and mental health, but they also focus on things such as benefits for employees here. So if someone is a working parent or a caregiver and say your loved one gets sick or, you have to do something for your children, is there time off that we have available that they could be utilizing so that they don't miss paychecks or that, there isn't any interruption in their work career? So we try to work with HR on a lot of those kind of benefits that are available to our working parents and caregivers. And we have some state benefits that are available and just some internal benefits also. So it's really about getting that information out to people. So those groups have really taken shape over the last year and been quite successful. Whether it be connecting with, again, employees or people out in the community. Last year, they hosted over 40 events, as a collective. And they also had over 3,000 people that they actually were able to come into contact with in the 2022 year. So those teams have been really impactful and hoping to continue to see them grow.
Okay. I know we only have a few minutes left, and I know I'm a member of the Race Equity and diversity group, but a Race Equity and Inclusion. But and I have to say, since and I thought I thought I knew a lot until we've had Shannon as our leader, Chief Diversity Officer. And you have provided the organization with excellent resources, trainings to educate yourself on words like unconscious bias. We don't even have enough time to get into what unconscious bias is. We don't have enough time to get into all of these mission critical terms you've mentioned. Are there ways for our listeners to make, not to say to use what we're using at Kaleida, but if they can, is there a way or anything that you can recommend for our listeners to learn more on diversity and a lot of these terms which you have been mentioning? Is there any one or two key resources as we end today's program that you can direct listeners to who may want to be as smart as you?
I I appreciate the kind words, but truly, there's such a wealth of resources out there. I mean, and truthfully, most of them you can find in healthcare organizations. Like on our website, we have a few resources of that nature, but also it just really depends on what you're interested in learning. I think after 2020, this has grown exponentially, and you can find reputable sources, whether you're at the American Medical Association and looking at their DE&I work and their anti-racism action plans, or if you want to look in a tech field. All these fields that we have in industries, they each have reputable sources that you would traditionally go to for other research and scholarly articles. And now they've done that for the diversity, equity, and inclusion work. So I wouldn't feel right calling out one or two because there really are just so many. So I would just encourage people to do a Google search and really find out, what information they'd want to know.
Okay, and I want to say for locally, if you want to read about what's taking place in neighborhoods, if there's a website called the Near East and West Side Task Force. If you Google Near East and West Side Task Force, although the report was done 21 years ago, you'll see a lot of what Shannon has talked about. The conditions have not changed. Also, Erie County, under Kelly Wolford, just dawned upon me, just published another health equity study, and that's on Erie County. Under I would try Erie County Equity Study, and the health. I can't think of the name of it. Pastor George Nichols, the Health Equity Task Force. They would also have information. Shannon refers to, she did national and local, and then what I referred to was local. So between Shannon's information, our combined information, Shannon, I want to thank you for enlightening our listeners and enlightening our community and enlightening the employees and all of management at Kaleida Health. So thank you so much. Until next time.
Thank you so much. It was a pleasure. Thanks.
Oh, you're welcome. And I just want to say, I want to thank all of our listeners for joining us. And next week, you'll hear from my esteemed colleague from Erie County Medical Center, and that is Cindy Bass. And I also want to mention the marathon, the Buffalo Marathon. There's half marathons and whole marathons. And that's another event sponsored by Kaleida Health. It takes place at the end of May and Memorial Day weekend. And I'll have more information next week. Or again, go on our Kaleida Health website and we'll have information on that. And in 2 weeks, God be willing, you'll hear from me, Francesca Messiah, Manager of Community Relations for the Kaleida Health Adult Foundation. Take care and be safe and stay warm. Bye-bye.